Bone remodeling is a fairly orderly process occurring continuously throughout a person's life. The process involves osteoclasts and osteoblasts, using paracrine signaling involving hormones, cytokines, and growth factors to control the activity of each other. This maintains a carefully orchestrated balance between bone resorption and bone replacement. Bone remodeling also helps regulate calcium homeostasis, mends micro-damaged bones from everyday stress, and aids in the shaping and sculpturing of the skeleton across the lifespan. Normal bone turnover occurs when old bone is removed and new bone is produced, in an effort to preserve the integrity and strength of the skeletal system. The process of resorption involves the large multinucleate osteoclasts. Osteoclasts are active at the bone surface where they secrete acids and enzymes, which erode the mineral and matrix of the bone. Cavities are thus formed, causing bone degradation. A membrane is formed between the osteoclast and the bone surface, which is called the ruffled border. Osteoclast activity and resorption then end by programmed cell death or apoptosis. Once resorption is complete, osteoblasts, or bone-forming cells, fill in the bone cavities, multiply, and form new bone. This process is stimulated by the secretion of pituitary and thyroid hormones and sex hormones, such as estrogens and androgens. Osteoblasts also secrete a number of cytokines that promote reabsorption of bone. The new bone surface is covered by a protective layer of bone-lining cells, or inactive osteoblasts, which serve as a barrier to certain destructive ions. Metastasis to bone occurs later in tumor progression and is a multi-step event. First, cancer cells detach from the primary tumor and invade blood vessels. Cancer cells in the bloodstream are attracted to preferred target tissues. Tumor cells reaching the skeleton adhere to the surface and inhabit the bone. Tumor cells then interact with osteoclasts, causing abnormal bone remodeling to occur. Tumor cells inhabiting the bone microenvironment release a number of factors such as a parathyroid hormone-related protein, or PTHrP, and cytokines including interleukin 6 and interleukin 11. These factors promote osteoclast production, thus leading to an excessive breakdown of bone at the tumor site. The osteoclast surplus leads to a release of growth factors from the bone as it is degraded. These factors include transforming growth factor beta, or TGFB, and insulin-like growth factor 1, or IGF-1, which stimulate tumor cell behavior and growth. Growing tumor cells, in turn, release factors that stimulate osteoclast formation, leading to a cycle of tumor growth and bone destruction. Painful and debilitating skeletal complications, such as spinal cord compression, bone fractures, and hypercalcemia, occur as a result of this weakened bone structure. These complications are commonly referred to as skeletal or bone-related events.